What is anemia? Outstanding morning, everyone. This is Dr. Dorwin Lajot. Now, let me tell you about anemia. Anemia is just a simple meaning. Low hemoglobin and red blood cells. Okay, that's simple, right? But having this anemia is not simple. It's very critical to have this anemia problem. And that's why we need to learn that today. Let me help you, okay, the ABCD of knowing anemia. Okay, ABCD of knowing. I will make this simple for you because this is very, to have anemia is, painful, and you will suffer, or people will suffer like many problems, okay? Like number one, kidney failure, or the increase of creatinine. And you know what? If the creatinine will increase, okay, the next is what? Dialysis. If a person will go through with dialysis, is so also painful, and people will, like, they are suffering and they have this discomfort and financial crisis, and we don't want that to happen to any members of our family. Okay, I see you. Jake, Brian, David, thank you so much for watching. And please tell me in the comment section your place, where you're coming from. And please tell or tag your friend if they want to know more. Because you know what? When I studied this case, anemia, from the publications of the National Institute of Health, I found out that people can really get anemia without knowing it. Okay, if their lifestyle is what, rice only, oil, or egg only, people will really suffer anemia. And that is our mission today, and that is our topic today. So if you're ready, please type 1 and say I'm ready in the comment section. Yes, thank you, Aunt Hansen, Zuniega Tata. Okay, now what's the ABC? Okay, the ABC of knowing anemia. A, okay, stands for absorption. Yes, thank you so much. Iloilo City. Yeah, we have a friend from Iloilo City. I think I am familiar with David. Okay, David. I think the son of Senior Crown Manager Juana Tobesa David. Yes, Jake, I think he's a Crown Manager at DZM. Now, absorption. Okay. You have, or you can have this anemia if what, you have a problem, or people will have a problem of absorbing what? Number one is iron. Okay, because the number one kind of anemia is low of iron, or iron deficiency kind of anemia. Okay, but there are three things that we need to learn more in the next minute or few minutes. Okay, that aside from iron deficiency anemia, okay, iron is one of the important part in hemoglobin. Hemoglobin is what? Is a kind of protein. Okay, can you notice here? Iron is what? Part in our hemoglobin, and hemoglobin is a protein. So absorption of not just this iron but also protein, because our body is made of muscles, okay, and these muscles is what? Is also a protein. And we can know here, we will recognize and know that if you have low iron, now people are, when they have anemia, they will think of only iron. But remember, when people have this atrophy, okay, of muscles. Atrophy is a decaying of some tissues like muscles. Okay, when this muscles is decaying or degrading in our body, then one of that is, the effect of that is the hemoglobin will also decrease. Okay, hemoglobin. Hemoglobin is very important in carrying this oxygen, okay, to the rest of the system. But not only that, hemoglobin is very important, okay? Not just distributing this oxygen throughout the system, including your eyes and brain and skin, but hemoglobin will also get or will act as a garbage collector, okay? Because if this hemoglobin is carrying oxygen to the cells, so that the cells can process your food, our food, okay, to give us energy. And what will happen? Okay, there is a waste, because there is a process inside our cells. There is also a waste, and this waste, okay, this is very interesting. You know what? When I'm reading this, knowing that this hemoglobin is not only distributing oxygen and other nutrients, but also collecting waste, okay, out from the cells and throwing it out from our body. And that is very vital in our health to maintain the quality and also the volume of our hemoglobin. Okay, so that is why avoid anemia. Okay, prevent anemia to happen first in absorption, by addressing your absorption of this iron, and also preventing this decaying of the muscles. Or if you are eating food, see to it that you can absorb this protein, okay, so that there will no decaying of the muscle. Because when the body can sense that there is a lacking of protein, okay, and you did not eat for the day or 2 or 3, okay, or during fasting, then your body will use the protein, okay, or by converting your muscles into protein, okay. So that's number 1. Absorption is very important, and we will solve that problem, absorption, because people will have malabsorption according to the Food Agriculture Organization. Okay, they mention about absorption in any country, even if you are staying in Europe or America, or even in developing country, people are suffering this absorption, and we will know that later, okay, in the next few minutes. If you stay longer, you will know that, okay. Now, so here's the second, B, okay, absorption, A, and B is what? Okay, the B vitamins. This is another kind of anemia, aside from absorption, absorbing iron and protein, because this will help your hemoglobin be maintained. And second is this B vitamin, especially the B12 vitamin. The B12 vitamin, okay? This is critical in creating red blood cells, because another definition we mentioned earlier, that anemia is what? Low hemoglobin and red blood cells. So meaning, if you have this low red blood cells, that is because there is a deficiency of B12. Okay, and if you stay longer here, okay, we will know where can we get this B12, right? And how to absorption, okay, B12. So if you have deficiency of B12, then this person will also suffer anemia. Okay, because B12 is helping the creation or producing the red blood cells. Red blood cells is important, no, in our blood, the blood count. Okay, and if you have low red blood cells, another problem will also be created. One of that is what? The kidney, okay, and the creatinine, and other, like your eyes, okay, and metabolizing the food, because cells is one of the organs that metabolize our food, like the adenosine triphosphate. Okay, so that is the cells. Okay, you don't need to memorize it, but that is a cells. Okay, when you lack B12, then this, manufacturing of energy will be lacking. Okay, okay, so let me drink first your water. Tubig. Okay, now third is what? A, B, C, and the D is what? The third kind of developing anemia is this one, decaying of what? The red blood cells. Imagine the B12 is producing what? Red blood cells. This one is your red blood cells is decaying. Okay? Decaying. Like for example, red blood cells, okay, have a lifespan of 120 days. Okay? Some of the red blood cells cannot what? Finish the lifespan until 120 days. Some of the red blood cells will just die, 30 days, 40 days, 60 days. They cannot what? Go through the whole lifespan. They will just die. Then the problem is, since you have lacking of B12, then the production of these red blood cells is lacking, then no one can replace, okay? No red blood cells can replace. Okay, imagine, you have a red blood cells, but no one will replace it. You have red blood cells in your body. But can you imagine, without support, okay, without solid foundation, where? In your bone marrow, where the production happens. Okay? If there is no production, there is no stimulation of the red blood cells, okay, for the bone marrow to produce. So the first batch is 120 days, and the second batch will not happen. Then the red blood cells will go down, and people will suffer problem more than anemia. Okay, anemia is just one of the signs that if that cannot be solved, then another problem will take place, or the complications will also happen. Okay, so decaying of these red blood cells without the support from your bone marrow is very dangerous. Okay, decaying, right? The fourth one is C. We automatically go to the D, right? So C is the creation of the red blood cells, right? The creation. Because to maintain the red blood cells, the creation must be maintained, okay, in the bone marrow. Okay, so let's recap this. Okay, ABC, the absorption. Okay, if you lack iron, if you lack protein, then your hemoglobin will go down. So a person will already have this anemia. Second, the B12, okay, deficiency. So B12 is also part of the absorption, but here we define it differently because they have different kind of anemia. Okay, as stated in the National Institute of Health, 4 kinds. So another one is the creation of the red blood cells. Even if you have the red blood cells, okay, but since every 100 or every 90, I think 24 hours or 90 hours, your body can create red blood cells. There is a cell growth, what they called it, cell growth. No, every hour your bone marrow is creating. That is why there is a stages. Okay, there is a what we call baby red blood cells until they mature and replace and they will die, then replace, then they will die, then replace. That is a cell cycle. That's why I strongly believe that if that cycle can be maintained, then we have longevity. Okay, longevity is not because you are already 60 years old or 70 years old, you will stop thinking that okay, I'm already 70 years old, then the next time of this is I will die. No, we don't know our end, right? But we know that if we maintain that based on science, because when our body can maintain the cell cycle, then that's the reason why we can see that people can live 90, 100, 120. It depends on the sustainability of the health and economy. So we know already the ABC, right? ABC absorption, the B complex or the B vitamins supply, okay? Then the creation of the red blood cells in the bone marrow. Then what? The decaying. You know, red blood cells is also decaying, right? So now, what triggers, okay, the malabsorption? What triggers the deficiency of B vitamins? What triggers, okay, the decaying of these red blood cells? What triggers? Number one is what? Toxins. Okay? You need to avoid toxins. Okay? By not going into or touching anything that or food that can give you toxins. It's either food or it's either toxic materials or environment that has more toxins. So avoid toxins, because when toxins, okay, enters into the body, then it can create injury. And injury is what? Part of still the end process is what? There will be a decrease of the red blood cells. The red blood cells will be affected by this injury, right? But sometimes, even if you avoid toxins, okay, or the place that is full of toxins, there is also what? Inside the body, our body can create what? Toxins. How? Because of this imbalanced circulation, okay? Toxins can be created inside because of the, according to some study, that when your circulatory system, okay, will have this congestion, will have slow, okay, or the circulation can be hindered, okay, then the blood can be what? Be full of toxins. When that happens, then there is a what? Decaying of your red blood cells, because they cannot what? They cannot flow easily, and then they will just die there. Right? Okay. Do you remember that we mentioned about what? The lifespan of the red blood cells, 120 days. They will just what? Die in that location. Okay, they cannot travel. That is one of the problem in the lymphocytes, lymphoma. There is a nodes there that will be inflamed. What will happen? According to some report, that lymphatic system will just die in there. They cannot go back to the circulatory system, or they can go back to the heart, okay, to be fed with the oxygen. Oxygen is very important in hemoglobin, because it's the one that carries oxygen. Because oxygen, according to this book, I will read to you this book, okay? Do you have this book? This Living a Healthy Lifestyle, okay? And this is one of my book that was published already, and it's already out. Okay, so according to this page 31 that I wrote, that oxygen is important in our body. Okay, 90% of energy is supported by oxygen. So that's why one symptoms in anemia is what? You have numbness in your legs, low energy. Why? Because the transportation is not there. What is the transportation? Meaning the carrier of the oxygen? It's your hemoglobin. That is why one of the signs and symptoms is the energy. Okay? And also concentration. One of the signs of anemia is your concentration. If there is disorientation in your brain, then that is one sign, right? And the third is what? Is strengthen our heart, creating less risk of heart attacks. People will have this ischemia because there is what? Barrier or congestion in your heart. And that is what? Lacking of oxygen. Okay? And it stabilizes our nervous system, especially our digestion, because our stomach needs oxygen to process the food. Okay? And it speeds up our body recovery. Okay? So, that's one thing that if you have this book, you will also learn many things to live a healthy lifestyle. Because I found out that one of the advices in the National Institute of Health is that, to manage anemia is to what? To have a live or healthy lifestyle. Second, if you feel that signs and symptoms, then you need to check your blood. You need to see your doctor and what? Maybe your doctor, if you tell me you have this sign and symptoms, your doctor will give you or will have you in what? Check your blood count. Okay? When your doctor check your blood counts, okay, you will know that your red blood cells or your hemoglobin is low. Okay? It's not only that you have this kidney failure, but you know what? I worked for 12 years, assessing and analyzing many cases. And I found out that people have these low red blood cells, this low hemoglobin, even if they are not diagnosed with anemia. They only have hypertension. They only have this diabetes. They only have this heart problem, okay, or other problem. That is why it's better to go and maintain and monitor your blood count. That is very important if you want to live a healthy lifestyle. And one of the way to live a healthy lifestyle, living is to be active. The word living is the same with active. Be active in healthy lifestyle, right? Healthy lifestyle, eating the food. Now today, many children are suffering from anemia. Okay, why? Because it's not because that they eat less of food, but because what? They ate more of the food that cannot support iron, protein, and B complex, okay? And toxins that can what? Injure the cells, especially the decaying of these red blood cells, and will also make your bone marrow what? Stop producing red blood cells. There is a food today, okay, the focus of study, okay, because people who are having this chemotherapy or radiation will also what? Injure the red blood cells, and the decrease of red blood cells will happen or will take place. That is why one of the study now is focusing to address the bone marrow cancer or this severe anemia. They replace or they will introduce this stem cells, right? There is invasive, meaning invasive treatment is through injection or IV or operation, right? But there is a food that will also help what? Stimulate the production of the red blood cells or the bone marrow to produce the red blood cells through stem cells, okay? The stem cells, what they call it, the mesenchymal stem cells in the bone marrow can be triggered, okay, to be produced in the bone marrow, okay, to support the decaying, okay, of the red blood cells. And the creation of the red blood cells is what? Through stem cells. We have our stem cells in our bone marrow. That is part of our blood stem cells. So the food that got studied and nominated in the Nobel Prize is what? This blue-green algae. Okay, blue-green algae. Same thing with spirulina. Because of the phycocyanin, it's not only that phycocyanin is anti-inflammatory, but also can stimulate the production of these stem cells that will repair your bone marrow and other things, like replacing, repairing, and stimulating to produce what? These stem cells in our bone marrow. So my friend, what's the lifestyle that you can do to solve and prevent developing anemia? Can you live a healthy lifestyle? Okay, are you decided and willing to live a healthy lifestyle? Okay, please comment in the comment section, or if you want to have this book, okay, Living a Healthy Lifestyle, right? and the author is yours truly. I'm willing to give you what? This book. Okay, comment in the comment section and I will tell you how to get this book. Okay, just published today with ISBN. Okay, and the ISBN is that in the purpose of this book is to help people live a healthy lifestyle, to get more knowledge, because when you have more knowledge, okay, you have confidence every day for your health. So, what's your takeaway today? Your takeaway, okay? Please put in the comment section and we answer what? The question about how to address this creatinine. Because creatinine can increase with infections and anemia. So answering this anemia, okay, will also answer, okay, mostly of the problem in increasing the creatinine. Most people in the dialysis today is having this anemia. So live a healthy lifestyle, avoid toxins. Okay, you can what? Possibly prevent anemia. This is Dr. Dorwin. Thank you so much for watching. Okay, Auntie Tata and Sir Jake and the rest of our viewers, thank you so much. And you can visit also my Dr. Lajot TV, because this FB Live will be what uploaded in our YouTube channel. Please subscribe, comment, and notify or click the bell button so that you'll be notified for another topic. Thank you so much for watching. Wing Alboro, thank you so much. If you just visited just today, then go back or visit the Dr. Lajot TV, because this will be uploaded there. And please subscribe and click the bell button so that you'll be notified. And thank you so much for my producer, okay, in the next room, okay, my wife, okay, Cecil, for supporting this FB Live and this FB page to be what? Shared to those people who are what? Needing this program. Thank you so much. Alhamdulillah. Assalamu alaikum.